So here we have this patient who has come to us. You can see the marking that we have done. This is called a classical male pattern baldness. There is recession of hairline. You can see here, there's no hair follicles left. There's all recession which is going towards this side of the scalp. So this is a marking that we have done for the hair transplantation. So on the back side of his forehead, he has this is the hair follicles where we are going to harvest and take the follicles from here, and we're going to implant all the hair follicles safely into the planned proposed area. This technique is called as FUE technique. It's called follicular unit extraction technique, where we harvest the follicles from one part of the scalp and handle it safely, process it, and then fix it to the proposed area. So all of this procedure is done under local anesthesia. It will be painless and there's no risk associated with this. And this surgery is very safe and will be done by a hair transplant team. And we're going to shift the patient to the operation theater now. Thank you.